Good afternoon, everyone. Welcome, welcome. We will be getting started in about a minute or so. We're going to let a few others join us today, but glad that you all are with us this afternoon. Good afternoon. All right, well, for the sake of time, I just want to say welcome everyone. Glad that you all are here with us this afternoon. Today's webinar is titled My Path to Independence, Independent Living for Individuals with Intellectual and Developmental Disabilities. And just to let you know, we will be recording today's webinar. You will receive the recording, the PowerPoint, and any shared resources via email. And also there is live transcription available if needed.
Thanks, Ray. Welcome, everyone. We are so happy and really thrilled that you've joined us for this much needed webinar this evening. Tonight's presentation is really a direct response to an expressed need that we've had from so many of the families that we serve at the Adult Disability Medical Healthcare. ADMH is a medical clinic that provides comprehensive care for teens and adults with developmental disabilities. And disability impacts us all. 1 in 5 individuals in the United States has some form of disability. And as caregivers and providers, we really try to provide the most appropriate and the best care that we possibly can. Transition to independent living is a challenge, but we hope that tonight's presentation will provide some tools that can really help along the way. At ADMH, we provide care within the model of a patient-centered medical home. We try to provide care that is comprehensive, compassionate, coordinated, continuous care that is accessible and person-centered and family-centered. But the medical piece is only part of the care. We're really so fortunate to be able to provide care as an interdisciplinary team. So tonight we welcome our social worker, Raynell Washington, in presenting this important webinar topic. Thanks. Enjoy the webinar.
Thank you, Dr. Vitaleski. So as Dr. Vitaleski mentioned, my name is Raynell Washington. I am a community services specialist at the Center for Leadership and Disability at Georgia State University and the social worker for the Adult Disability Medical Healthcare, ADMH. So I have the privilege of delivering this afternoon's content and being with you all. So again, thank you all for being here this afternoon. So preparing for independent living and beyond. A few of the topics that we are going to touch on this afternoon is transition, daily living skills, health management, money management, and a few success strategies that we hope will help with those of you who are considering independent living. Before we kind of move forward though, I just want to kind of start this engagement. I want to hear from you all. What are some of your concerns surrounding independent living? And if you may, please maybe list some of those in the chat. What are some of your concerns surrounding independent living? As Dr. Vitaleski mentioned, it is a challenge, right? It's not an easy transition, but it's definitely possible. So thank you, Nicole. How to find living spaces that are safe and affordable, quality of care, safety issues, housing, Medicaid waivers, yes, and the wait list. We know that's definitely a biggie in our state. not having a dependable caregiver. And thank you, Rita. Yes, and so I want to first acknowledge your concerns because it's normal to have these concerns, right? But it's okay to have them, and it's okay to figure out how can we either manage them or try to address them or put supports in place as you all help navigate this transition. So the transition, when does it begin, right? When should you all begin having the conversation? Preparing for independence does not begin as soon as you're ready for it to occur. It's a long process of having many conversations. And I oftentimes encourage patients and families to begin talking about independent living while you're nearing the end of your high school program or your transition program. And by also first referring to your IEP and the transition plan in your IEP. Oftentimes it's a good thorough layout and description of some of what you're looking for, what you're hoping for. I want people to continue to have this level of hope of what's next and all of the possibilities. I know there are concerns, I know there are challenges, but still being able to discuss what you look forward to and what you would like to see for yourself. So in that transition plan and having everyone a part of your team, who are those individuals, families, loved ones, caregivers, your teachers, anyone that's helping provide any care or support to you, involve them in the conversations of what are you looking forward to after school or in the future? What do you want your life to look like? Building expectations for what life can look like, if that's exploring employment, independent living, post-secondary education, training programs, day programs, all of the endless ideas and opportunities, kind of just first having a conversation of what do you hope for, and then how you can hopefully be able to obtain that. So before we get into the different housing options that are out there, I feel it's best to, one, understand your needs. We know that there are many options, but I feel it's best to, when understanding your needs and knowing your needs, that'll help you be able to identify what option may be best suitable for you. So knowing your abilities, right? Because you want to highlight and build upon your strengths, but then also knowing your disabilities. Where are your concerns, areas of improvements? Practice talking about your disability characteristics, your learning styles, your needs. How do you communicate? How do you best receive and understand information? What accommodations and supports do you need? Deciding how, where, and with whom you live with is an important step. And you have quite a few options to choose from. And deciding which one is best for you, again, having many conversations with your family, exploring the different options that are out there. What supports comes with these different options? Are there supports available? What supports can you bring into the housing options to help figure out what's most suitable for you? So let's talk about some of the different housing options that are available. Some you may be familiar with and some that you might be a little unfamiliar with. So there's shared living arrangements with a roommate. I know many individuals who live with a roommate in an apartment or in a home. There are separate living arrangements at home, maybe still with your parents or loved ones, caregivers. So some individuals may live in the basement of their home or may live in like an in-law suite or something like that, to where you're still with your family and have the support of your family or whomever your support may be, but you also have this little separate entity for yourself where you're able to have your own privacy and still do things independently on your own. University housing for those who are interested in pursuing post-secondary education, college, university setting. There's those housing options. A group home, so a residential option where you are able to live with several other individuals who may have different needs, some similar to yours and some that may differ. And of course, depending on the program, some group homes can be staffed with counselors and other workers who help residents live on their own. They come in many varieties and can be paid for in many different ways as well, including private pay or state programs for people who have disabilities. And in many cases, group homes also serve as a social setting, having being a social outlet where they're able to identify community and be able to socialize with others. There are also host homes, residential homes for one or at the most two individuals with the disabilities. And the individuals lives with a family that provides 24-hour care and oversight. There is also assistant living facilities that house residents in their own apartments, either within a building or a complex of buildings, and they receive non-skilled care and assistance with maybe bathing or cleaning or maybe even also administering medications if needed. And then skilled nursing living facilities that tend to be for individuals who need around the clock 24-hour medical care. It's sometimes not the most ideal option for some, but for some it is based on the level of care and the severity of their medical needs. So again, understanding your needs, what accommodations do you need, which may then help you easily figure out which option may work best for you. So daily living skills, I wanted to touch on this because again, transition doesn't just occur, right? It's a process. And there's things that you can do in the midst of that process to ensure that you're ready, right? Or that you have some skills under your belt that can assist you as you strive to live independently. Making your bed, putting things away, doing some household chores, vacuuming, cleaning the restroom, washing, bathing yourself, right? Those self-care skills, dressing and undressing yourself, toileting, right? What are your needs with toileting? Preparing simple foods and meals, setting and clearing the table, washing dishes, understanding finances. At ADMH, we do what is called a Waysman to assess daily living skills. And that's just to get an idea of where individuals are and some skills that they may want to work on or focus on and improve upon that may help them prepare to just, one, have a little bit more autonomy with some of their needs, but to ensure that they're confident in doing some of their things on their own. And please note that this looks different for everyone, right? Everyone may have their own way of doing certain tasks, and that is perfectly fine. Everyone's needs are different, and you might need a little bit more assistance with some things versus the other, but it's more so having an idea of where you stand completing different tasks. Health management. Health management is very important, right? Understanding which medications you take, which vitamins you take, and when are you supposed to take them. Encouraging you to have a routine, plan it out for the week, keep an updated list on hand, and share it with those who you come in contact with, who may care for you, support you, your medical providers. Have a reminder system in place. I use my phone for everything. If I didn't have it, I don't know what I would do. Reminding me for meetings, when I should take my vitamins, when I say I'm going to do something. And it's just so it helps me kind of stay on track. It gives me a little alert, a little reminder to make sure that you take your medications. Again, preparing them out in the week. There's so many cool little preparers that have the days and the times, depending on the different times that you may need to take medication, just to kind of organize it, lay it out, and it's already planned. Maybe every Sunday evening, you'll prepare your medications for the week. Having a process for refilling your prescriptions, because we don't want there to be a lapse in you being able to take your medication because the prescription wasn't prepared, right? It wasn't refilled. And so what type of process and procedures do you have in place to where it's done either automatically or that you know? So again, maybe another reminder to remind you of when it's time to request another prescription if you may be low, to ensure that you don't run out and there's no lapse in you taking the medications that you're needed to take. And then also practice making appointments. When you're living on your own, even with supports, I think it's important to, if able, to be able to contact your medical providers if you for in case of an emergency, or just to make sure that you're up with your annual doctor's appointments, your dentist or any other advisors, anyone that specialists that you may come in contact where you need to have appointments with on a regular. Just practice. You may not be the one that's responsible for actually scheduling it, but it is a good practice to have, to just practice making the phone call, speaking with the nurse or the receptionist, and again, setting reminders so that you don't miss your appointments. Very, very key, as being responsible, being that responsible adult and living independently. Any questions so far? I know I'm moving along, might be a little fast, so just stop me if any questions come up. We'll also have an opportunity for those of you to ask questions towards the end. So now I want to discuss money management. And again, please note that everything that I am discussing, it's very generalized information that I'm providing. And this looks different for everyone based on their needs and their abilities, right? And so by no means am I saying that you need to know how to do this perfectly to perfection with no room for error or anything like that. But just some things that, if able, that you might want to work on, or just having some understanding on. And if not, making sure you have supports in place, or caregivers, family members, those of you who may have joined us, things that you all can also think about that you might want to have prepared or set up to support a smooth, healthy transition. So money management, developing strategies around spending, set up a monthly, weekly budget for expenses. How much do you have that you can spend a month? How much should you be mindful of spending per week? Having a bank account with a parent or a guardian, right? Having a checking account, which is really, really good for managing your Social Security income, maybe income from employment. And I want to highlight the need to not, for there to not be no more than $2,000 in those accounts, just to ensure that it doesn't jeopardize your Social Security income. So once you receive Social Security, you will be asked where the money should be deposited. So setting up a checking account in your name with your Social Security number, so that the money goes directly into that account, and we know that that's going to go towards their finances and their needs. And then also having a savings account, those special needs trust, stable accounts, just to have perfect for emergencies, perfect for changes that may occur in the future. So just good things to kind of plan for. And understanding money and learning responsible use of money. Are you able to identify dollars and coins? Do you use a debit card, right? Do you know how to review receipts? Or I know someone who still balances a checkbook, right? So a little old school, but that's okay. Whatever works best for you. And again, it looks different. So for you, it may be accomplishment just being able to identify various money, right? Denominations and things like that. But again, if you use a debit card, making sure you don't go over your spending limits. So having those budgets in place. Community supports. So one of the fun things about living on your own and even not living independently, just a good thing to have in place is community supports. Engage in activities that interest you, regardless if that's the arts, music, Special Olympics, church programs, advocacy programs. Engage in social groups and outings. And for those of you that may be interested, even in dating, Again, the opportunities are endless. And I always encourage individuals to look into things that interest you, because if you lead towards your interest, that will keep you more engaged. Volunteer with your community or with an organization, and maintain relationships. So just because you may not live under the same roof as your mom or your dad or whoever your caregiver may be, it doesn't mean that those relationships won't continue. So making sure, phone calls, text messaging, FaceTiming, which is my personal fave. My family doesn't live in Georgia, and so we do FaceTime calls all the time. It just makes me feel like I'm really getting the fullness of them by being able to see them when I talk to them. Or our all personal fave, especially in this time, which is Zoom, right? There's so many different ways that you can continue and maintain relationships. So those things shouldn't change too much just because you all don't live in the same place anymore. And a few success strategies. So create an emergency plan, which is a biggie. And your emergency plan can look different, and it's curtailed to you. Listing your emergency contacts, your medications, your healthcare providers, putting together all of your important documents, insurance, or any type of things like that that may be important to you. I also like to include things that, if you're in case of an emergency, maybe something that you hold near and dear to you. Maybe it's a photo, maybe it's a stuffed animal or something like that that might bring a little bit of comfort in time of an emergency. Establishing a daily routine. So I know people love routines and do well when they have a good, healthy, effective routine in place. Creating a schedule for your meals, your medications, your activities, your tasks, and get in a little bit of a rhythm, right? Of your day-to-day and what your day-to-day can look like. And then lastly, establishing a strong community of support. And I know community can look like any and everything, right? So that might be of your family members, that might be your care support team, that might be friends, peer support, church members, people from a day program or school, people you grew up with, anyone that you have a close relationship with that you feel you can lean on in happy times and in sad times, but having that strong community of support so you don't feel alone. You have someone that you feel confident in going to. And to my caregivers and family members that are on the call today, I want to ensure we are empowering adults with disabilities to live independently. It promotes equal opportunity. It increases self-determination. Let's dignify their choices. We want to be supportive. Again, there are concerns and challenges and things like that, fears, right? Which is normal. Let's acknowledge them, but let's see how we can work through them. And I think also when we empower individuals to live independently, it helps build their confidence, right? Being a part of a community and living as independently as possible are among some of the most important values and goals shared with people in general, right? But also people with disabilities and their families and their advocates. I want people to be confident in what their hopes and dreams are and can be. Again, endless opportunities. And I just believe in starting early, having these conversations, talking to whoever, again, is a part of your care team to figure out what's best, right? What housing option is available to me? What funding do I have that may be able to support the housing option that I'm interested in? Having those conversations. And again, some of this information is very generalized. And so to have more in-depth conversations, I encourage you all to, involve your medical providers and tour different places, visit them, ask all of the questions that you may have so you can feel confident and comfortable in the choices that you are making. So now I want to turn it over to Janice Nodman, who's going to share a little bit more about ADMH. Janice? There she goes. You're on mute, Janice. We are 2 years in, Janice, and you're on mute.
Unmute.
There you go.
Okay, so I am delighted to see so many familiar names that are on this call. I hope each of you will come away with one thing that you will test and try with your family member that you may not have thought about. So I am the executive director of the Adult Disability Medical Healthcare, and I am mom to Evan, who has actually accomplished a lot of these things and is still continuing to do so. At ADMH, as Dr. Vitulewski mentioned to you, we know that it is very difficult to transition from pediatric to adult health care, and that was why ADMH was founded. I want to make sure that all of you know, and you can share with others, that our medical home model, which is partnered with Urban Family Practice Associates, comes in a variety of fashions. You can come to us for both primary and specialty care that in one group, in one format, where we are providing everything to you. Or if you have your own primary care physician or live far enough away where it's not that convenient, you can still access ADMH as comprehensive consultative care. And that would mean that you come to us once a year or twice a year, and then you continue with your own primary care physician. We are one of the few clinics nationwide that provides this type of concept that is offering both primary and specialty care under one roof. The next slide, please. And as Dr. Vitulewski mentioned to you, that we use the patient-centered medical home model, and all of those areas that are highlighted here are our guides to how we want our own family members treated and how we wish to treat you. That's compassionate, coordinated, continuous, accessible, family-centered, and comprehensive. The next slide.
So I just want to...
Yes.
Go ahead, Janice.
There's one thing I wanted to mention, which I mentioned right before we got on the call. An hour before this particular workshop, Evan, that is my son with a disability, had his update of his CIS. Now, anyone who is obtaining a medical waiver must have a CIS, and a CIS is supports intensity scale. And it is something that is done every 3 to 5 years. It kind of really, when we did this, sis this afternoon, it made me feel so good that the items that are on this on this scale that show exactly how much support is needed is exactly what we do to help people become as independent as they possibly can. And it may be that you need lots and lots of supports, or it may be that your goal is not to have as many supports. So I think that this comes so much in line with trying to push our family members to be as independent as they possibly can be. So, and thank you, Mark, for adding that information into the chat box.
Thank you for sharing, Janice. And yes, thank you, Mark, for adding that link. Now I kind of want to take time to see if any of you have any questions. And feel free to enter your questions in the chat and or to come off mute to ask your question. And while you all are maybe thinking, I do want to share one of the resources that I identified with you. And you all will get the link to this, which I think is a really cool checklist as you're trying to assess level of need and care. So I'm going to pull that up. Is everyone able to see that okay? Alrighty, great. So this is a life skills checklist. And it's a checklist that you can do together to kind of just go through, ask these different things, assess these different areas. These are personal life skills. So a lot of those self-care skills that I mentioned early on. But then this is one for emergencies. So understanding fire exits, can you use a fire extinguisher? Do you know how to contact 911? What do you do if you're locked outside of the house? So a lot of those safety measures. Here are some that ask questions about nutrition and dietary, money management and financial planning, healthcare skills, sexual health skills, interpersonal skills. So it is assessing many different areas. And again, it is okay where you fall, right? It is not about being perfect in these areas. And, you have to be perfect in order to live independently. So that's not the case at all. But definitely important to assess where you are so you can know what supports and or accommodations you are in need of. So I just wanted to just show it to you all, and we will share the link so that you all can do this together. I strongly encourage you all to complete this together and do it on a annual basis, right? You might do it today where you're just having the conversation and you're seeing where you are, work on some things, and then maybe next year around the same time of when you first completed it, you then see if you've made any progress. All right. Hi, Jackie, I see your hand up.
Yes, hi, and it's late in the evening, so I will not be getting on camera, but I do want to say hello. I do recognize a lot of names and faces on here. My daughter Kendra had actually attended AD, okay, I might get your acronyms wrong, ADMH, is that it?
That is perfect.
Before, and with Dr. V and some others, and I want to say that was her very first time getting a complete blood panel. And it was really, at that time in her life, it was critical that I see all of her levels. So I thank you for that. If we didn't live so far, I would have kept her coming there. And who knows? But I do want to say what you shared earlier about the housing options was very eye-opening. I'm excited to say my daughter is moving into her own home within the next 2 months. She's a person that needs a lot of support, but I've been blessed to work on it for many years and find her a place that I am so happy with. But one of the things I was in a meeting today, one of the things I said that I think we miss as parents a lot of times, we think we want certain things for our children. We think we want to help them advance and be independent, but we keep them to ourselves. And I meet so many parents that think their kids are going to go off and live on their own and go to college or go to work, and they never even let them out of their sight. They've never even spent the night out anywhere. And one of the biggest things you hear parents say when we have children who have special needs is that I don't trust anybody. And I think that's how we say that. But my daughter was in Babies Can't Wait, and she got on a school bus at 3 years old, and so I had to trust. I didn't know who that was driving her off on that bus, but I had to trust that. So we have been doing it. We just don't think we've been trusting. So, but I do encourage a lot of parents, even ones on here who maybe haven't, find little ways to let your child go just a little bit. And someone told me that years ago. And so I started off just letting her go away for the day to a day camp. And then when I felt a little comfortable with that, I let her go one night. And then I let her go for a week. And trust me, it felt really good. So now that she's moving out on her own, I think we practiced enough years that hopefully me and my husband, we might only cry for about 2 weeks. And once I see that she's doing well and she's happy in her new environment, I think we're all going to probably live some better lives around here. So I just want to share that.
Thank you so much, Jackie. And I'm so happy you were able to join us and be able to share that. And I love the slow transition, right? Even before you even knew that independent living could be a thing, right? You probably was doing this just to do it, right? But look how it slowly prepared her for this moment and this new transition that she's about to embark on. So, yes, it's camp season coming up, right? And so we know that they have little week away camps, overnight camps, even starting one night of overnight respite if you're able to do that, to do slow transitions. And even some programs, residential programs, offer slow transitions too. Visiting options. Again, things don't have to change too much and so quick. It's a process. Hi, Dr. B, I see your hand up.
Yeah, thank you, Jackie. Thank you so much for sharing that. That's so wonderful, and we really wish all the best with this new transition. That's wonderful. But just to that point, I wanted to say, Ray was talking about the checklist and how important it is to go back to it. Sometimes when we do a checklist, we do it in a way that's like looking at what skills one has, and it can be sometimes a little negative, but if we look at it in a positive way and see that people can change, sometimes people are not accomplishing those goals because they haven't been encouraged or allowed or they haven't tried to do some of those things, because for that same reason that they're kind of kept closer to, parents might continue doing those things for them or not have that expectation. And sometimes when you go back a year later and you think, that this person is accomplishing some of these skills because they were encouraged to expand their horizon and actually do some of those things. Like you might see those skills actually improving, those numbers improving, not because their disability has or their physical health has changed, but because of that switch from encouraging that independence, which is an important thing. So I think we're speaking to that same point that you're talking about, Jackie. Thank you.
Yes, thank you. Any other questions or comments or testimonies? We welcome it all. And if not today, reach out to us. We are here to help, to support. If you don't know what to ask, that's okay too. Just starting the conversation, involving, again, your team, your community of support, reaching out to people who may already be living independently, right? I will tell you all, I have been to some of the best schools, I feel like, and have gotten some great knowledge, but some of the best information and knowledge that I have gained has been from you all. I am always sharing, y'all, guess what a family told me, or guess what, someone just shared with me. And so talk to one another, people, I've been so fortunate for people to just share their stories with me and their experiences, and some of the best information and insight that I've gained. So please talk to your peers, other families who who are going through similar things, and who you may not know is going through similar things. Just spark up the conversation. I also wanted to provide our contact information as well. My email here, washington.admh@gmail.com, and Janice's email as well, nadbin.admh@gmail.com. And again, ADMH can be of service to you as well, in whatever capacity is most suitable for you all. So if you would like more information about ADMH, please visit www.theadmh.org. And I believe Janice is going to come on and share some final thoughts.
So one thing I just wanted to mention to everyone, I have learned quite a bit from each of you, but I will tell you, please don't be afraid to let your family member fail, because all the worst that can happen is that they get back up and try again. And that is absolutely one of the most important things to do, is keep moving forward. This is a stressful time, and you can make it happen.
Yes, yes. Nicole, I see your question. Will you share the information on housing options and where to find more information? Yes. So again, we will share the PowerPoint with the resources. I'll also download versions of the resources so that you can easily be able to print them. We will share the recording to this session so you can watch it 50 million times over if you would like. And again, the resources, the PowerPoint and the recording. And if you just have any questions along the way, feel free to reach out to us and we will offer as much assistance as we are able to. Okay. Thank you all for being with us this afternoon. We truly, truly appreciate it. We hope to continue to do this and be able to address you all's needs and concerns, and also just to come on and see one another and be with one another and talk about things that's going on. So we really, really appreciate you all joining us, and I hope you all have a wonderful rest of the afternoon.
Thank you.
Thank you.